Joining us now is Dr. Alozi, and as I mentioned, health officials confirmed the young patient was not vaccinated, and the CDC saying that this is the first measles death in the country in a decade. So what are the latest numbers across Texas and New Mexico?
Well, first of all, thanks for having me. I mean, like you mentioned in the intro, it's about 124 in Texas, there's 9 in New Mexico, and almost 95+% have been found to be unvaccinated so far.
Well, what do you think the numbers look like here in El Paso when it comes to childhood immunizations?
Yeah, so first of all, I know or I've heard that there are at least 1 or 2 cases here in El Paso. You can see in the graph, right, what has happened is around COVID, there's a drop in vaccinations. A lot of people believe that that was just because of COVID. Kids weren't in school physically. There's a lot of teleeducation. They've come back up. Measles specifically is around 97 to 98%, and that's really where we've been historically.
Well, can you explain the vaccine exemptions by country and by states?
Yeah, so if you look at the map, I think the good thing is that out here in West Texas, we do really well. Right, so we have one of the lowest exemption rates in the state. You can see in the rest of the state, in northern Texas, East Texas, there's a lot more exemption rates. And what happens is that a parent can say, hey, I don't want to give my kid an exemption, a vaccine. And there's a lot of reasons for that. Some are medical, some are non-medical. You can see across the country, unfortunately in Texas, we still have some of the highest vaccine exemption rates in the country as well.
Well, can you talk about the vaccine rates over the years?
Yes. So the thing about it is that that sort of background rate of when kids don't get vaccines, there's a medical exemption. And that stays pretty consistent. It's about 0.1 to 0.3%. And you can see that has not changed. What has changed over the years is the amount of parents that are now taking either non-medical exemptions or just saying, hey, we don't want to give vaccines. And I think that's what's really driving a lot of the problems that we're having and unfortunately may start to have going forward.
Okay, well, parents are terrified about the measles.
As they should be.
I'm one of them.
Yep, absolutely.
Well, can you explain how it spreads?
Well, the biggest thing about measles and why it's so scary and worrisome is that it has this huge infectivity rate. It's called an R naught. And what that really means is the average number of persons that somebody with an infection can transfer to another person. For measles, it's about 12 to 18, and for comparison, in influenza, it's about 1. And so that's one of the pieces that we have to look at. When people do get sick, it's called airborne, right? So just like tuberculosis, it's airborne, and it can stay in the air, unfortunately, up for 2 hours, and that's a problem.
Okay, well, the spread of measles is preventable.
Absolutely.
So can you go over the anti-vaccine movement in Texas?
A couple of things. So in terms of how's it spread, cough, cold, coryza, people sneeze, they cough, those particles stay in the air, and like I said, they can stay up to 2 hours. When you talk about the anti-vaccine movement, unfortunately, like we saw in those exemption rates, it's going up over the years. A lot of it is misinformation online. A lot of it is fear from parents. I totally get it, right? There's like a lot of conversations about autism and whether vaccines can cause autism. This has been totally debunked. I think it's important, and I get what HHS Secretary is saying, but that's not true. We haven't had these outbreaks, right? It's very clear. This is the first person to die of measles in a decade. That shows that we haven't had these outbreaks.
It's still a little scary, though.
It is super scary, and you can see on the screen why it's scary, right? People can go to the hospital, about 20%, about 1% can get really sick, and less than 1%, even with the best medical care, can actually die, and that's what we saw recently in West Texas.
Well, where can we go to find more information, helpful resources?
Yeah, well,
we always have those available for us.
Yeah, if you're a parent, a couple of things. One is that if your child hasn't been vaccinated, really consider getting the vaccine. The first shot can give up to 93% protection. The second shot, 97% protection. I think that's really important. And then on top of that, just talk to your healthcare provider.
Okay.
I mean, go to the doctor, talk to your pediatrician. Hey, does my kid need a vaccine? The short answer is almost always going to be yes. And if not, you can go to Immunize El Paso. There's a host of other resources around the community.
All right, Dr. Alozi, thank you so much as always.
Thank you.
Let's get to storm.